So, hi everyone, thank you so much for coming to this session. I'm really excited to speak with you for the next 90 minutes. My name is Kristin Lupfer. I use she, her pronouns. I'm the project director of the SAMHSA SOAR TA Center at Policy Research Associates. I am a social worker. I'm a mom of a 4- and 8-year-old, and I'm really excited to talk to you today about the SOAR model for children and youth. So real quick before we begin, by now you guys have all probably found all of the controls within Zoom. If you could raise your hand in Zoom, since not everyone's on camera, which is totally fine, to say if you are familiar at all with SOAR. If you've heard of the program before or been involved at all. So can you guys find the reaction? Got a couple of hands raised. 1, 2, 3, and applause. All right, so just a few of you. Oh, we got up to 6, 7. Excellent. So almost a third, just a little under a third. Okay, fantastic. Well, I'm so glad that some of you are familiar with the program and that this is new to the rest of you, because I'm excited about sharing it with you. So let's go ahead and get started. So first thing I have to do is read to you this really fun disclaimer. The views, opinions, and content expressed in this presentation don't necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. These are my own. All right, so what are we going to do in these next 90 minutes? My hope is that I will help define for you the importance of SSI benefits for children and youth who have a serious mental illness and their families who are experiencing our risk of homelessness, including the income, health insurance, education, and employment supports, and housing stability that comes with it. I will explain the effectiveness of the SSI and SSDI Outreach Access and Recovery, or SOAR, model for expediting those SSI application decisions and improving the approval rates for Social Security disability benefits. And finally, I want to identify opportunities for you all to get involved with SOAR for children, including connecting to local SOAR efforts, the SOAR online course, and the SOAR online application tracking program, which is our outcomes tracking program. So that's what we hope to accomplish in our short time together. So what is SOAR? What are we here to talk about? So SOAR is a model for assisting eligible adults and children to apply for Social Security Administration disability benefits. It is for individuals who are experiencing or at risk of homelessness. So we're really focused on this vulnerable target population who have a serious mental illness, co-occurring substance use disorder, or other physical disabilities. SOAR is sponsored by SAMHSA, as you can tell from the disclaimer, and we work in close collaboration with the Social Security Administration and have been doing so for over the last 15 years. We work in all 50 states and Washington, D.C., and are excited to have that nationwide presence. So why SOAR for children? So SOAR for adults was initiated in 2005 and has been growing ever since that time. But SOAR for children is newer, where we are younger. And one of the reasons that we were able to expand the SOAR initiative to include child SSI applications is, of course, because we have a serious problem that we have children and youth who are experiencing high rates of homelessness, and those children and youth who are experiencing homelessness have higher rates of disability, have higher rates of mental health problems. And because we have startling and unacceptable numbers of families with children and unaccompanied youth who are experiencing homelessness, we have to address that. And addressing that involves income stability, and bringing that income stability and access to health and recovery services to get people stable is what we want to see. And so we believe that this model can help address this problem. So we see SSI benefits as a foundation for resiliency and recovery. So it is more than income. This is not just about getting access to that check, which is absolutely essential, but it's more than that. It's access to healthcare and housing. It comes with increased education and employment opportunities. We see a decrease in institutionalization and hospitalizations. And we see that it's kind of this building building block, So when we see, the foundation of this house on the graphic here, we've got those SSI or SSDI for adults benefit payments combined with employment, maybe from the parent or caregiver, with the insurance that's coming with that, and building that foundation for housing, treatment support services, and then ultimately wellness and recovery, which is what our end goal is. And we find this as a tool to get there. So SSI for children, just a little bit of basics. I could talk to you for days about Social Security and SSI and all of the intricacies, but we're just going to talk a little bit about it today. So we're all speaking the same language. We're all kind of starting on that same foot, and we can talk about how you can learn even more. So SSI stands for Supplemental Security Income. It is a benefit for low-income individuals, and so financial need is a big piece of eligibility. And when Social Security looks at financial need, they're looking at a complete picture of income, living arrangement, and family resources. So there is SSI for adults as well, and that picture looks very similar. And for those of you who might be familiar with Social Security disability benefits for adults, there are a lot of commonalities with SSI for children. But today I'm really going to focus on kind of the differences for kids. So SSI for children, it's intended for children who are disabled or blind. But the federal benefit rate is the same as it is for adults. It's $794 a month this year. Next year, it's going up to $841 a month. We know this is still poverty level income. It isn't high enough, but it's a start. And SSI comes with Medicaid in most states. All right. So I want to talk for just a second about SOAR across the lifespan. So I've referenced, a couple times that there is, disability benefits for adults, which is the kind of other side of the SOAR initiative. But you can see how SOAR and these benefits can play a role at different stages of someone's life. So we're talking about children and youth really today, but children, we're talking about from birth to age 18 is what the SSI child benefit is for. Children are eligible for SSI only. And what Social Security is looking at when they're looking at whether a child meets disability criteria is they're looking at the child's functioning compared to a child of the same age who doesn't have any impairments. We'll talk in a little bit more detail about how that's defined. When we talk about youth and young adults, it gets a little bit more complicated because once a young person reaches age 18 attainment, they're no longer eligible as a child and they have to meet eligibility criteria as an adult. And so there's a redetermination that happens when they turn 18. So there's this really important kind of transition time for youth who are aging out of foster care, for youth who have reached age 18 attainment to requalify or be redetermined for eligibility as an adult. And then finally, for adults, SSI and SSDI benefits, which is Social Security Disability Insurance, eligibility begins at age 18. And the focus for adult eligibility is really whether the applicant is able to work and earn at a substantial gainful level. So the measurement changes from a functional compare with children of the same age to ability to work. And then the work picture really comes in there at the adult stage. So I talked a little already about kind of youth and young adults. And one of the things that we focus on a lot when we're working on a disability application for a youth is that we don't have perhaps an extensive work history to look at those struggles with work. And so we look at school records and other collateral sources, comparing, functioning to the youth who doesn't have any impairments to see how we can kind of document that disability. When I mentioned the age 18 redetermination, benefit that Social Security has put in place for youth who are aging out of the foster care system is that they're able to apply for SSI up to 6 months prior to leaving care so that they can get their entire application processed and determined so that benefits can begin as soon as eligibility begins rather than waiting for that long process to occur. Okay, so the definition of disability for children. So we're not talking about any child who has a diagnosis or any child who has some sort of condition or impairment. Well, what we're looking at is a child whose illness or condition is really impacting their ability to function at home or in school or in community, as compared to children of the same age who don't have an impairment. So it's a really different kind of look, and it's really focused on the functioning of the child and how they're doing. So when Social Security takes a child application through their determination process, there's a lot of steps that kind of go into this. And I promise I won't go too far into the weeds, but the Social Security Administration, I'll tell you a little bit. The Social Security Administration is the federal agency. They administer the SSI program. They're the ones who you apply with, and they're the ones who establish payment and who you communicate with after payment. But there's this other mystery agency in the middle that people don't realize exists that's making the medical decision. So there's a state agency called the Disability Determination Services, who makes medical decisions for Social Security. So every state has their own DDS. They operate it using federal rules, but they operate within the state. So there's, slight state differences in how things are done, all under the same rule umbrella, if that makes sense. So the sequential evaluation is how the application kind of moves its way through the approval process. So there's a non-medical decision that's made at SSA, and they say, okay, does the child meet the income and resource limits? And they look at the income and resources of the child and the income and resources of their parent and caregiver in their household. They look at whether or not the child's working at SGA. So if it is a child of working age, they look to see whether they're earning at a substantial gainful level. If they are, they're not eligible. This doesn't apply to most children who are applying, but it could. So then once it gets past that stage, if you kind of meet those income and resource requirements, the child isn't working over a certain level, do they have a severe impairment? So is the impairment severe? Not just do they have a diagnosis or a condition that's being maintained well, but do they have a severe impairment that is impacting their functioning? So if yes, then they say, okay, let's look really specifically at this impairment and see if it meets or medically equals a listing or functionally equals the listing. So a listing is a set of criteria set for different body systems and impairments that one could have within that body system. And they have defined at what level those impairments are disabling. And so have, some short descriptions of what that looks like, what those symptoms might look like, depending on what the condition is. Sometimes there are test levels or score levels. With IQ functioning, there's, IQ numbers. But in any case, this is all public, something we teach about in our course about how you can find out what is that listing, how do we meet it, how do we get the evidence and documentation needed to meet it. And if the child's impairment do either meet medically equal or functionally equal the listings, they're approved. And if not, they're denied. So there's kind of two parts of that approval process, the non-medical piece and the medical piece. All right, so what makes SOAR unique? Why do we need this, big model to help children, youth, and adults apply for Social Security disability benefits? Well, the process is incredibly complex. And what we had learned over the years is that most people are denied on initial application, not because they're not eligible, but because they're missing documentation. They're not able to follow up. They don't know how to follow through with the process because they don't understand how it's working. They don't have a stable address or contact information, and so they're not getting notices. SSA communicates mainly by mail. During the pandemic, there is no office for you to go into. So there's all of these things that make the process more difficult to navigate. And so what we've done with the development of the SOAR model is identify all of those areas where applications that should be approved don't get approved and address ways to solve those barriers and problems. And a SOAR trained caseworker or a family member or any other advocate who might be involved with the application are the heroes to this process. And we've identified what we call the critical components, but basically 5 things that make a huge difference and make actually a statistical difference in the rate of approval or not on an application. So first, we use an SSA form to serve as the appointed representative, which means that we get copies of all communication that go to the applicant, so we can stay in touch with the process. We can make sure that the application is moving through the process correctly, that we're following through, and we know what's going on. We collect and submit medical records. The key to a disability application approval is solid evidence showing that you meet or equal the listing. And we do that through the submission of medical records and what we call a medical summary report. So we document the disability to show with clear evidence that the applicant meets the criteria. And doing that, getting that evidence together is absolutely crucial, because what we know is that our medical records aren't enough. What's written up in those records often isn't enough. It doesn't have good, rich, functional descriptions about how the illness or impairment's really impacting that child, really impacting that youth. And so we do that through the development of evidence, through interviews and documentation, and writing up this intensive report that makes all of those key connections that need to be made about what's really going on with that child or that youth or that adult. We get that medical summary report signed by an acceptable medical source, so their treating physician or doctor. We do a quality review to make sure that it's a good, solid, complete application. And then we see those applications get approved, and we get them approved more quickly. So it is not a passive model. It's not just like writing SOAR on an SSI application and it's going to get approved more quickly. It's really being an active participant in documenting and submitting good quality complete claims. So when those good quality complete claims are submitted, we see an incredible increase in approval rates and decrease in time to decision. So this is just a little snapshot of our 2021 outcomes. These outcomes are for adult applications. I'll show you child applications in just a minute. So our approval rate in 2021, it went down a little bit this year, I think totally due to the pandemic. I think I could safely claim that. But our cumulative approval rate has held steady at 65%. So 65% of applications that are submitted using the SOAR model are approved on initial application. And that's over double the national average. So if just anybody applies for Social Security disability benefits, about 30.8% are approved. Only 30%. So with the application of the SOAR model, over doubles that. And we've been able to help nearly 60,000 people, adults, receive benefits because of SOAR. Not only do we see individuals getting benefits, which can be life-saving, can end their homelessness and help get access to treatment and recovery services, but we also see huge returns to our community programs and our communities. So with the receipt of SSI, counties and states can get reimbursed for general assistance that they paid out. So we see average reimbursements per individual at nearly $3,000 reimbursement. We see huge Medicaid reimbursement. So providers that were previously providing uncompensated care, they were providing services to people who had no health insurance. When they get approved for SSI, they get Medicaid, the provider gets reimbursed. And this is per beneficiary, averages per beneficiary. We see average retroactive back payments, about $6,000 a person, which is an incredibly stabilizing income for people. And then just looking at the total just income brought into local communities of participating localities, $564 million just in 2021 of individuals who are now receiving benefits because of SOAR. We know, you heard me talk a little bit about those critical components, those 5 critical components. Well, our top 10 states we know are implementing those critical components when they're using the SOAR model. And our top 10 states have an average approval rate of 79%. So we can see by looking at, we track our outcomes in a program that tracks what critical components were used with what applications. And we know that you're more likely to get approved if you're using all of the critical components. And that's what's happening in these states. So they're seeing a lot of great success when they implement the model to fidelity. So for child applications, so because I was saying earlier that SOAR for Children is a newer initiative. We launched the SOAR online course child curriculum in 2018. So it's only been 3 years, and we've had to deal with only 2 of them during the pandemic. So we don't have as significant numbers as we do on the adult side. But of those states and communities that have been able to start implementing SOAR for Children, they've had 650 decisions with an average approval rate of 72%, which is really fantastic, in an average of 113 days to decision. So in less than 4 months, they've got a decision, income in families' pockets, and they're ready to kind of keep going, keep moving on. So SOAR can't happen in a vacuum, though. We can't do this alone. We can't do it as just caseworkers and advocates and family members. We really need a good community collaboration to make it happen, because we are working with complicated systems that have to work together to be able to kind of function within it. And so we have, we work on the SAMHSA SOAR TA Center level with our state and local leads, which I'll tell you about in just a second, to help build these collaborations with housing providers, with hospitals and healthcare providers, with Native serving organizations and Native communities, with strong partnerships with education systems and schools, in legal settings for individuals who might be reentering communities, or youth who might be involved in the juvenile justice system, working with veterans and their families to kind of identify areas where people can contribute to the support of the application and process. So a little bit about how we operate at the kind of systems level for SOAR in order to help programs implement the model in a really sustainable way. So SAMHSA funds the SOAR TA Center, and that's where I work with a team of incredible people who are dedicated to building relationships within states, with program leads, with caseworkers, to help people use the model in the best way. Because our goal is to support the end user. We want to make sure that that person who is helping someone with an application feels supported, feels like they know what they need to do and can help get that approval and help people get the income and health insurance that they need. And so we do that through this kind of system of supports. So we do, strategic planning meetings, we've got webinars and learning communities, a lot of supports that we're doing virtually now to support the implementation of the model, helping to identify funding opportunities, troubleshoot whenever there are barriers that come up, helping to build relationships and collaborations with key partners and communities, all of that. And we try to develop the resources needed to use the model kind of out of the box, that we don't need to recreate anything. We work hard to make sure that the tools are there to be able to do it. And then we listen to the community about what you all need. And if there's something you need, our team will work to develop it so that it can be used kind of across the country as well. So we have a network of state team leads. These are individuals who work within their states, often at a state Department of Behavioral Health or a state housing agency that is kind of committed to serving this population and to helping coordinate efforts at the state level. We train local leads in communities. So this sometimes at the county level, regional level, city level, to help facilitate local implementation and to really be on the ground with providers and assist the providers who are using the model. And they help to direct local implementation, do different local training, supporting kind of quality applications on the local level. And then finally, the case manager, caseworker, or advocate, or family member, or whoever it is who's at that direct level, is the one who is completing those high quality SSI applications using the SOAR model. They're the ones who are communicating with local SSA and DDS representatives, tracking their application outcomes. So SOAR is implemented kind of across the spectrum here. All right, so I talked a little bit about this, but this is just some of the things that the SOAR TA Center does to support the implementation of SOAR. So the SOAR online course or courses, I'll talk about in a little bit, is one of the main things that we do in terms of training on the model, on Social Security regulations, how to submit a good quality application, all of that. We train our state and local leads through a leadership academy. We have a 3-day event where we talk about the systems level implementation, how to support SOAR caseworkers, how to get this going in your community. We have a library full of resources. We do a monthly newsletter. We've got bi-monthly webinars. We hold monthly, we call them soaring over lunch calls, but these are kind of monthly office hours where people who are using the SOAR model call in with their questions, and we just have a 1 hour nonstop like Q&A, which is a fun event. And then individual TA. So I mentioned the team who provides support to local communities. We will help a state leader figure out a funding plan for more SOAR caseworkers, or we'll help that individual on the ground figuring out how to answer question number 38 on the 8,000. So the whole spectrum there. Okay, so the SOAR online course, the model for training for SOAR, I guess, has developed and changed and expanded over the years. And in its infancy, over a decade ago, it was a 2-day in-person training that was delivered by trainers, a network of trainers across the country. And in 2014, we converted that in-person training into an online course so that we would be confident in knowing that people across the country were receiving the same information, the same good quality information, that the information was able to be updated all the time, because it turns out it needs to get updated all the time. Social Security forms get changed, regulations get passed, little tweaks need to be made, new resources or tools are developed, new processes. And so it's a way to stay 100% up to date across all geographic areas and provide a free, easy to access at any time training. And so that's what we're really proud of and really excited about, is that the SOAR online course, adult curriculum and child curriculum, are both free, web-based, self-guided, so available at any time to anyone. All right, let me see here. So this is just a couple of screen captures from the course, and I'll tell you a little bit about the curriculum. So we estimate that it takes approximately 20 hours to complete the course. So it's really intensive. You can see it has 7 classes. In each class, there's at least a dozen articles of information to read. There are videos to watch. There are tools to review. So there's a lot of information that's packed into the course. But what is unique about our online course is we didn't want to just provide kind of didactic information to trainees. We really wanted to be able to have trainees apply the knowledge that they're learning and feel really confident that they know how to use the information that they're reviewing. And so we developed a practice case, and we originally did this with the adult curriculum, and when we developed the child curriculum, we followed the same model. And we have found through an evaluation of the SOAR online course that this is really innovative in kind of the public health training world in terms of how to apply learning and information in an online course. So in the online course, you get to meet fictional applicants. So you get medical records and progress notes and watch actresses or actors talk about themselves. These are interviews. And so you have this fictional applicant, this fictional family, and you learn about the individual, you learn about the child or the youth, and then you apply it. You fill out the required Social Security forms, you write a medical summary report, which kind of tells the entire story, and then you submit that to us at the SOAR TA Center. We have individual human people that review every single one of those practice case applications and provides individualized feedback from, actually question 33, we were really asking this, or you want to make sure that when you're answering, question 14, that you're talking about all 4 of these providers, so that you can really know what you missed, what you did really great, to give that feedback. And completion of the practice case and the review of that successful completion results in 20 CEUs from the NASW. So one of the practice cases is for a young boy, and the interviews are actually with his mother. We didn't want to use any child actors, so the interviews with the mother. And then we have a young woman who is a youth, and we have an adult actor playing the youth character. But a kind of good way to learn how to implement the model in a really safe space where there's no judgment, there's no like risk of, you know, doing something that might mess up someone's application. You're kind of safe to try it out and test your knowledge. All right, so in terms of getting involved, the time commitment, you're like, this sounds like a lot. It is a lot, but it's totally worth it. So like I said, the training is about 20 hours. We estimate, based on reporting from SOAR caseworkers and our own experiences, I've done many SOAR applications myself, it takes about 20 to 40 hours per complete application. Now, this time estimate, in terms of investing time in the application, this is from like the first moment of meeting and engaging with the individual and their family to getting that decision letter, getting the check started, right? So it's all of it. It's all of the interviewing. It's all of the collecting records, putting everything together, all combined. It does require those SOAR critical components. So like I said, it's not a passive process. It does require kind of intensive engagement and work up front, but it is a lot easier to serve someone and help them get connected to resources and to housing when they have income and health insurance. It makes such a difference and brings such a stabilizing component to their lives. So it's absolutely worth it. We track outcomes of SOAR applications. That's how we know that the model is effective, because we track whether or not applications are approved when the model is implemented. And it helps our communities get new funding to support the effort. Because we know there's so much effort required in it, if we have staff who are working on it, they need the time to do it. They need time to invest. And you can't have a caseload of 200 people and do a good quality SOAR application. You have to be able to dedicate that time. And so we just had this recent success. I have to tell you about it because it's so exciting. So in the state of Kansas, they had been, implementing SOAR for a long time, working really hard, but we're struggling a little bit with outcomes. And they had, kind of lower outcomes, less than 50%. And they were like, we've got to figure out why our applications aren't getting approved. They identified that. They made a change in their processes and making sure that they were doing good quality applications that had enough evidence with them. And then over the course of 4 years, they increased their approval rate by over 20%. They're now in the 70s. And they showed this to the state, and the state is now going to invest in 10 full-time positions, which is just absolutely incredible. But it was because they tracked their outcomes and they showed that they could be effective using the model, and then they got an investment in their programs that they'll be able to use across the state. So it really does make a difference in kind of funding and sustainability efforts to track those outcomes, to show that the model works and makes a difference. So as we talk about getting involved with child SSI applications and supporting this effort, there are so many places where people can be of assistance. Like, I might have someone here who's like, well, actually, I'm just not going to be able to do that. I can't invest all of that time. I don't have it, but I want to help. And how can I help? So where in this, along this intercept, can I help in the process? Maybe I'm a school psychologist and I can help identify applicants. I can, identify that child who's experiencing homelessness, they have a serious mental illness, and can help make sure that I refer them to someone who can assist. Maybe I'm a social worker in the community who, has the time. I can complete the online course and I can help with that entire SSI application for that child and family. Maybe I'm a mental health provider and I can't do the whole application, but maybe I can go here in the middle and I can help with obtaining medical records and evaluations, or I can do that evaluation and I can help support the application that way. Maybe I'm a McKinney-Vento liaison in a school, and I can provide some systems level support to the process. And then finally, supporting resiliency and recovery, making sure that those children and families who are approved for SSI, I can help them identify housing or employment or education resources that they might need. So there's lots of kind of places along here where individuals or child serving providers can help support the process, even if maybe they're not going to be able to assist with the entire application completion. And this document is available on the SOAR website. There's a bunch of links at the end of the presentation where you can kind of find all of these resources that I've referenced. All right, so I kind of presented some examples of different ways that child serving providers could be involved, but I wonder if we could kind of open up the discussion a little bit to see how you can support your community in becoming involved in SOAR for Children. And while you think about that answer, I want to acknowledge I see a couple of hands raised, and I don't know if you are able to turn on your mics, but if you are, that's great. So we'll start with, I see Erica Richards. I saw your hand first. Do you have a question?
No, I don't have a question. I don't know why.
Okay.
Sorry.
No, that's probably, you might have it still raised from like when I asked the question a long time ago about knowing about SOAR. Okay, are there any other questions? Anyone have a question?
My name is Mrs. Jeanette Hernandez. I'm a provider. I'm a family support specialist, and I'm always coming. I've been doing SSI letters and redeterminations for about the 28 years that I've worked in this community health service position. But sometimes it is confusing for families to how to answer the question.
Mm-hmm.
I love your agency. I wish we had it in Connecticut. Because I think it would be so easy to having an agency that just works with that, because my job is more the school environment part, but I know families really have need that support. What recommendations do you have for agencies to take this how to connect to your organizations for this training? I would love to take it. I'm bilingual, so I'm able to work with both my families that just dominate a language barrier, just filling out the paperwork.
Yes. So excellent question. And thank you so much for your work and your decades of service. That's wonderful. So you are able to, absolutely take the course. It's available to you, a link to the course at the end of the presentation. And I think what an organization or a program can do is kind of take a look at how you provide your services, how you provide your support, and if you're currently providing SSI application support or not, and say, how can we make this work? Do we have three family support providers, and could we take part of one of those positions and really dedicate it to someone becoming an expert on SSI applications and helping with all the SSI applications that we might need submitted as a program or organization, or dedicating an entire person who can do that. We see some programs where it's kind of added on as another kind of a job duty or service of kind of regular case management or care management. And that can be tough sometimes if there are high caseloads, but it can work in some cases if there's not a huge need. So it just kind of depends on what it looks like in terms of staffing at an organization. And we then see, some organizations look to getting additional funding or pursuing additional funding that could specifically, fund a position to do it. So we don't have agencies that are like a SOAR agency in a community. We have just agencies that are out there, they're doing their work and they adopt this as a model that they implement. So if they're serving children and families, and some of those children have disabilities and they need assistance with an SSI application, that the agency may say, yep, we're going to train our care managers to use the SOAR model for assisting with SSI applications, and that's something that they implement, kind of like an evidence-based practice as part of that work. But because you mentioned that you're bilingual, we have just begun translating some of our materials into Spanish, and we translated a number of our SSI fact sheets. So I'll make sure to drop the link to all of our Spanish translations in the chat box so that you can access those. And we're doing what we can to translate more as quickly as we can. Yeah, that answered your question.
Yes, thank you. And the good thing we did this year, my agency did do, we connected to the administrator in the Social Security Department. He did come and give us training. So that's a good part, but it would be good to have resources like you indicated your agency offers. So I will look into it, definitely.
Excellent. All right. And if you want to, and this goes to anybody on the call now or the recording later, if you want to send me an email, I can help get you connected to, local efforts in your community, all of that. And I would love to do that or send you, specific resources that you're looking for. So I dropped my email into the chat just so it's easy to access. All right. Anyone want to kind of share thoughts that you might be having about how you might support your community in getting involved with SOAR for Children? Yeah, Nelson.
Hello, good afternoon, everybody. So my name is Nelson, and I am a parent partner and a peer recovery specialist and a veteran advocate. As a disabled war veteran myself, I am hoping to finish completing, since I already started the SOAR training, but I'm hoping to complete it and be able to help veterans such as myself who have children or are single with no children who are applying for Social Security benefits. We have been facing a big problem with interagency communication between VA and Social Security. And hopefully, I'm hoping to bridge that gap.
Thank you, Nelson. Thank you for your service and your comment. Good luck completing the SOAR online course. Yeah, we look forward to having you assist. We try to do a lot specifically about veterans. We try to work really closely with the VA program or grant program supportive services for veterans and their families. And we see SSVF grantees who can implement the SOAR model with across the whole spectrum. So perhaps with that veteran who might have a disability, or that veteran family member, that child who may also have a disability. And so we see some SSVF providers will complete the adult curriculum and the child curriculum, so they can help with kind of both types of applications. So yeah, so there's a question in the chat. Can I reach out to SAMHSA regarding coming to my organization to train one of our programs? So we don't have funding right now to do in-person training, but we do virtual presentations and events. And the online course is the only way to get trained. So the kind of full training to use the SOAR model requires completion of the online course. There is no in-person alternative. But what we do offer is support through the online course. So we host virtual training cohorts where we'll have people register for the online course together. They'll start doing that work in a self-paced way, and then we do weekly check-ins with a check-in meeting. We answer questions. Are you making progress? Do you have any hang-ups? That sort of thing, to help people navigate their way through the course in a structured way in a group. We've had some communities that will host in-person online course training, like in a computer lab, where everyone will come together and complete the online course in person together, which can be a nice way to do it, to get rid of all the distractions. Like, it can be hard to focus on completing an online course when you have everything else about your work coming in, either coming in the door or the phone ringing or the email coming or whatever might be happening. And so that's a way to get the distraction-free environment to complete the online course. So there's a bunch of different options. We try to kind of make it work for whatever the community or program's need is. But if you send me an email, we can talk specifically about that, figure out what works best for you. So yeah, good question, thanks. Anyone else have a question or a comment?
Hi, this is Jeanette Hernandez again. I'm sorry. What does SOAR mean again?
Yeah, so SSI, SSDI, which are the Social Security Disability Programs, Outreach, Access, and Recovery. All right, not seeing any other hands or questions in the chat. So just a little bit about getting started. Like, what are those next steps? What can we do? So identifying your child and youth counterparts, your either within your own agency or other agencies that you might be affiliated with, and talk to them about their contacts, their specialty areas, what they can do, how they can contribute, kind of take a look at that intersex model, like where can I get involved in the process, or who do I need in this process. You can help to organize a SOAR for Children orientation. I can do a presentation like this, for your community stakeholder group or for your agency. I can do that, or my team of liaisons, and assess your kind of current need and capacity. Like, do you have a lot of families with children who need to apply for disability benefits? Do you have capacity to help serve them now? Do you need additional capacity? We can, along with your local or state leads that may be present in your communities, schedule meetings with SSA and DEDS to talk about, a SOAR process for child SSI claims. And then once you're to the kind of level of implementing SOAR in your community, making sure that there are youth and parents on your steering committee, if you're able to put one together, to make sure that those voices are there, present and heard. All right, so some local contacts that might be important. We've just shared some information about systems of care. Of course, you guys are all very familiar with the National Federation of Families, just a link to their affiliates. And then Youth Move National is a great organization. For those of you who might be unfamiliar, for youth services and advocacy and youth representation. All right, so I mentioned some of the documents that we had translated into Spanish. Well, this is an example of one of those documents, the English version. But we developed a set of 6 fact sheets about SSI for children. This is one of them. This is SSI for children for parents and caregivers. And so it's targeted, specifically to answer questions that a parent or caregiver may have about how SSI could help children, who's eligible, how they may be able to contribute to help in the process, what resources are available to them, and then a little bit about the SOAR program at the bottom with contact information. So this is a flyer that you all are welcome to use. You can use this with parents and caregivers that you may be working with, and can help with kind of providing more information about SSI and SOAR. The other 5 fact sheets we've got one, they're all structured the same way. They look similar, but each have a different color scheme to kind of differentiate them, and each have a little bit of different information, but standardized in a way. So we have one that's targeted towards education providers that you might provide to school professionals. We have one targeted to mental health and behavioral health providers, one to housing and homelessness providers. I'm probably going to forget the last one, but you can see how, depending on the different perspective of each stakeholder group, we wanted to kind of tailor and target it. But these can be used to kind of share more information with each of those specific groups. So this is just a handy resource. And so we have these, the 6 sheets available on our website in both English and Spanish. All right. So I mentioned before how important outcome tracking is. And so SAMHSA has developed and has available a free online application tracking system, which is just a web-based database for tracking outcomes. It is extremely user-friendly. It takes about 2 minutes to enter an outcome into the system. It's HIPAA compliant. It doesn't contain any personally identifiable information, no protected health information in it. Helps us to monitor quality of applications, and totally free. And this is just a little screenshot of the dashboard where you can see, your initial outcomes, compare them to your state and national, gives you a little bit of information about applications that you're working on. Just a good way for a caseworker to track their efforts and to celebrate their success. All right, so this is, I think, my just about last slide, was just leaving you with some next steps to learn more about SOAR. You can get in touch with your SAMHSA SOAR TA Center liaison. So like I said, every state has a liaison assigned to them. It's available to help in any way. So you can reach out to us. We have local and state leads and a state directory on our website. So you can reach out to local and state leads if you want to do that directly. And of course, you are all invited to register for the SOAR online course at any time you want. Again, it's free and available for all. So here's the list of links I promised. So the SOAR website and online course here, outcome tracking system, all of our child and youth resources we have in the library page, and you can kind of scroll through and see what's available there. And then a couple of links from directly to Social Security's website on their disability information and employment support information. And these copies of the slides and everything should have been uploaded into the Whova system, so you should be able to download them as well, because I know you couldn't jot down all of those links that quickly. All right, so we've got lots of time left for questions, so this is good because I wanted to make sure we had at least a third of the time to talk about whatever it was that you all had questions about. What are you still wondering about? What could be your next step? And feel free to ask in the chat box or ask verbally too. Oh yeah, Diane, I see your hand.
Okay, it's more of a comment, just so you know. So I have 2 children that received SSI benefits when they were kids, and they transitioned into adults. But while they were kids, my husband also was able to get SSDI because he was disabled and could not work any longer. And one thing that happened that I didn't know that was going to happen is that when they became adults and they went into adult system, they still get some of his SSDI along with SSI. And at the age of 20, I couldn't figure out why they got Medicare along with Medicaid, and nobody could tell me why, but it was under him at that time because nobody knew. So it's a very confusing, and people don't have the answers. None of the providers working with my family knew why.
Yeah. You're thank you so much for that comment and sharing that story. So that a benefit that I didn't mention because we just don't have time to cover it all, but something we do cover in the course is what you're talking about, that benefit. Social Security calls it disabled adult child. And basically, if you are the child of an individual who was a worker and paid into the Social Security system and is now either themselves retired, disabled, or deceased. If the child also has a disability, they can receive benefits off that worker's record. And so that's what was happening for your kids. They were getting, benefits off of their parents' record. And so that's, it's a really wonderful benefit for that, disabled child who, is now an adult, still disabled, but can benefit off of their parents' earning record. So yeah, that's great. All right, I see April, your hand up.
Yes, hi. So my comment is more like of a concern. I have a lot of families that I work with that the barriers we run into is how you talked about that it's still under the poverty guidelines to receive SSI or SSDI. And I do believe there will be like $10 over or $200 and over to apply or receive food stamp benefits. Do you guys see this across the board? Or I do believe here in Nebraska, they might be raising it again. I have to reread that email, but I was just wondering if other people have run into this concern.
Yeah, so I mean, it definitely is state dependent and how a state has set up eligibility for SNAP benefits and those income levels. So we do see in some cases where the receipt of SSI for a family, depending on the family size, would impact their SNAP benefits. And there's definitely some advocacy around changing that, because it's unjust. Again, my own words, not SAMHSA's.
I agree with you. I try to give the people as for the families that I work with, as here in Kearney, Nebraska, we are so blessed. We have food pantries that are just absolutely amazing, but some people can't drive to go there. So there's, I don't know, like with food stamps, they would be able to somewhat get things delivered to their home. It is a barrier. So thank you.
You're welcome. Hey, Sue.
Hi there, I'm Sue Lozen. I'm a certified parent support partner with FACT, Family Advocacy and Community Training. And I also have lived experience. That's how I could get this job. So my daughter is now a young adult, and I'm finding this with other transitional aged youth, in that young adult area where they may have the SSI. And then if they work at all, it really throws things off. And it's almost like as a parent or even a provider, you're hesitant you don't want to hold your child back. Mm-hmm. But it's really hard to break that barrier to get those supports as an adult if they can do any type of work. And I wondered what your thoughts were on that.
Yeah, Sue, thank you so much for that question. So yeah, there is a lot of kind of misunderstandings and confusion about working while either applying for or receiving benefits. And that's one of the scariest things, that these benefits are so hard won in the first place. Without the SOAR model, we hope they're a little easier won this way, but that you don't want to risk losing them. And there's a lot of misinformation that's out there about, if you go back to work, your check's going to get cut off and that's the end of it. But in fact, there are work incentive programs that, when applied right and reporting, working the way that it should be, that can really raise someone's total income up while not risking their eligibility for some of their benefit, and of course that health insurance eligibility, which is so key, at least on the adult side in states that haven't expanded Medicaid. Like that SSI eligibility is their access to Medicaid. And you don't want to risk that. But what we do know in our experience is that people can go back to work and still maintain their benefits and health insurance. And for SSI, it is going to have an impact on it, but our motto is work always pays. So even if an SSI check is lowered from the federal benefit, full federal benefit rate from working, if you combine the earnings and what's left of that SSI check, it's higher than the original SSI check. And we've got some really cool calculators on our website where you can kind of plug in, like, what happens? Like if I go back to work and I earn $600 a month, what's going to happen to my SSI check, and what are going to be my total earnings at the end of that month? If I go back and work and earn $1,000, what's that going to mean? Mm-hmm. And we're able to kind of show with that calculator and help walk it through with people to say, okay, this is, what's going to happen. And this is the earnings level that will impact, your check stopping. Right. And this is the income level where it works out. And that sort of, we call it benefits counseling, is so important to help someone know what's right for them. Like what's the right level of work, both for their, own kind of symptom management and how they're doing, just individually, their own personal wellness with work. And then what it'll mean to their, benefits continuing and all of that. so there's, yeah, a lot of good supports and resources there. So if on the SOAR website, we have an entire section in the library on employment and work incentives, because we know that well, now what, 841, it's not enough. And so if someone is able to work some to increase their, total income, we really encourage it. And there's just so much benefit that people get from working anyway. That's not the income. So
I think it's so frustrating and discouraging for families. Even though I've been through it with my daughter, I mean, they change things all the time, but they really do like to deny first. And so people who don't have the support, even my type of support, just let it go. They get frustrated and they just think, okay, and it's just been lost. But like I've been through is you think you have it, and they're a young adult even, and they're approving it, and then something happens and they have to review and go through all that again, and they deny all over. You start all over again. It's very frustrating. It becomes very wearing as that keeps going on. So it's good to know that there's these supports. And are these nationwide? Are these?
Yeah.
Okay, thank you.
Yeah, you're welcome. Any other questions or comments?
Sorry, I have one more question.
Yeah, please.
So if you know of a family where the child has had been concerned that they feel that they are capable of being their payee, but the parent took over as the payee, and there's concern of how that money was being spent, is there somewhere where that, well, now he's not a child, but young adult can turn to show that he is competent to be his own payee?
Yeah, so that's a great question. So they can do that by contacting the Social Security field office and telling them they'd like to, establish themselves as their own payee. And Social Security has a process, they call it capability, but they do a capability interview. And they can do that, just with the individual, and they'll ask some questions about budgeting and money management and things like that, and try to do just a lay person capability interview to do that. And sometimes that's all that's needed to happen.
Okay, I'm sorry. Go ahead.
I was gonna say, if that doesn't work, if there needs to be like a little bit more evidence, there is a separate Social Security form that a physician can complete. And it's called something similar to that, but like a physician statement of capability. And if they had, a healthcare provider or someone who could help fill that out and basically say, yes, John Doe is, capable of managing his money. I'd like to, support his request to be his payee or something like that. And they can fill that out. It works both ways, that form. Like sometimes physicians will fill that out and say, I really recommend that this individual has a payee because of XYZ. So it can go both ways. And I'll say that Social Security, their preference is for people to be their own payee, like for adults. So that's what they would like, that default. And so if they're able to establish capability, that's what they want to do. So that's one, and I'll try to drop some of these links into the chat box. I'll try to pull them up while we're talking. I lost my train of thought. Yeah, oh, right, the problems with the payee. If money was misspent, there are also ways to report that misuse or payee abuse or misuse through Social Security. And so that would be like another recommendation. If that is an ongoing problem or a problem that needs to be reported, there are mechanisms to report that, because, unfortunately that does happen for people sometimes. So,
okay. Like, yeah, if that young adult wasn't living with their parents, but yet they weren't giving the young adult the money. If that young adult didn't want to report it, would, I don't know how to say this, is it appropriate for other family member to report it? Yeah, so a third party could report it, and that happens sometimes when there's, like
an advocate, a third-party advocate for, you know, an adult sometimes who's like, you know, I'm seeing that this, you know, this individual I'm working with is experiencing homelessness. They're on the street and they get SSI, and, you know, the payee, who knows what's happening with that money, can help, you know, report on their behalf. Like, this is, I am clearly seeing this from the outside. It's not happening. And the payee's, you know, required to make sure that the funds are used to support the, you know, care for that individual. So, yeah, great question.
Thank you.
Yeah.
This is
Yeah,
Jeanette. I have a quick question on, now that we're talking about from the questions that everyone has asked, is really good questions because it helps me to understand a lot the process. Is there a specific diagnose for a child, not an adult, because I know with children, with adults it differently, that it automatically qualifies them for SSI?
No. So there's nothing that's automatic. So remember when I mentioned a little bit earlier, I talked about the listings, the SSA listings. I'll pull up the link and drop it in so you can kind of take a look. So the way that the listings work is they look at body systems and then symptom categories within them. So if we pull up the childhood listings, and you guys can follow this link along with me. Like, let's say if we look at the mental disorders for childhood listings for Social Security here, they're organized by sections. So there are sections that are neurocognitive disorders, schizophrenia spectrum and other psychotic disorders, depressive, bipolar and related disorders, intellectual disorder. And then as you kind of click through each one, it'll tell you at what level that's disabling, and based on different child ages too. So a child's functioning in different age groups changes. And so they look at the child based on their age about what type of functioning that they're, you know, expecting is disabling or not. And so there isn't a specific diagnosis for any of these mental illness categories, but it's symptoms. So in the schizophrenia section or category, they're looking for documentation of delusions or hallucinations. So they're not looking for that like diagnostic code, if that makes sense. The only thing, I think there might be a few listings in intellectual disorder where if there's a certain IQ score by a certain age that there might, meet that listing. And I would say that that's, one of the sections where you could meet a listing in that way. So, but it all depends. And so, like, I think what we recommend SOAR providers to do, or anyone who's helping with an SSI application, is when you're, working with a child, youth, or adult, you go here and you find like where their illness or condition might end up, and try to read about what they're looking for based on that. What symptoms are they looking for? What impairments are they looking for? And then we go and find the evidence, right? And we gather up that evidence from teachers and parents and other caregivers, so that we can show that it meets what they're doing. And it's a really helpful tool, these listings, to find the evidence that you need.
Thank you.
Yeah, you're welcome. So I see a few hands raised, but I don't know if they are just lingering from before. So if you have a question, just go ahead and ask it. All right, while we wait for questions, I'm going to put in the chat box the link to the rep payee misuse information for the people who were looking for that. Doretta, excellent question. Can an individual who is incarcerated apply for benefits? Yes, there is a pre-release application process. There has to be an expected release date. And standard time pre-release that you could apply is 30 days prior to the release date, unless there's a pre-release agreement in place, which there is in most places, and then it's 90 to 120 days prior to release. So you can get that application submitted, processing, so that perhaps you even have a decision before release. So when the individual's released, they can then say, all right, I've got my proof of release, and get their benefits started. Like, this is where I'm living now. They're not eligible to receive benefits while they're incarcerated. So if they were receiving them, they get suspended. And if they weren't already receiving them, the benefit doesn't start until release, even if the decision is made. And we've got a bunch of information on the SOAR website about the implementation of SOAR in criminal justice settings. And I'll drop that in the chat here and grab from the library. All right. What other questions do we have? All right. So the last thing I'll drop in the chat is the directory on our website. So this is your directory to find your SOAR TA Center liaison, to find your state and local leads. It'll take you to the SOAR website. So you'll see across the top, there's a tab for the online courses, the library and tools. So absolutely don't hesitate to reach out. You can, ask questions, ask for, a presentation for more information, whatever it is. We are here to help. All right. Thank you all for sticking with me, for coming to a Social Security benefits presentation. Not always the most exciting, but we think it's so important that we get excited about it. So I appreciate your time today and hope to hear from all of you in the future. So, thanks so much.